Good afternoon. Uh, U.S. James Amenge, a consultant obstetrician gynecologist based in Nairobi, and a Hifu specialist and laparoscopic uh, surgeon enthusiast. And I'm here to discuss a little about a commonly mentioned ovarian cysts. And the big question I'm probably basically going to discuss is, can ovarian cyst be amenable to Hifu? And Hifu, in this case, we're talking about high intensity focused ultrasound, a new technology in the country that we've basically been using as an option, treatment option for uterine fibroids and adenomyosis. In various episodes, we've discussed about Hifu, the good, the bad, and the ugly. And so for now, it's just critical to make some clarification with regard to ovarian cyst. So one, it is critical to notice that as long as a woman is in the reproductive age, 15 to 45, or even to 50, as long as they're still having their normal menses and the ovaries are intact, then it's not unusual for cysts to develop. And most commonly, the kind of cysts that develops are relatively small, they are uniform, they are smooth-walled, the wall is thin, and they'll appear, reappear, disappear, and they have normal forms of progress in the ovary. However, there are instances when a cyst, which is basically a collection of fluid within the ovary, and oftentimes surrounded by either some smooth membrane that we are calling a capsule. So oftentimes cysts are not harmful and they do not require any treatment, but there are special circumstances where they may require treatment. And these circumstances include, one, when they're causing problems, and especially if they're causing severe pain that are not responding to a pain medication, then we may want to consider surgery. There's a size threshold. Again, when they achieve, depending on the age, they may want to go for surgery to remove them. Cysts may make or put the ovary at a risk of rotating on itself, and by doing that, it can result into blockage of the blood vessels going or supplying the ovary, causing the cells of the ovary to die off, what is famously called as ovarian torsion. In that instance, it becomes an emergency. There are times when a cyst can rapidly grow in size, especially when there's some bleeding happening inside it, and it can actually rupture. So when a ruptured ovarian cyst exists, there are instances when it can cause what we'd call severe pain in the pelvis, and that may require attention. It's also important to make a note that there are special categories of cysts that may require very, very prompt treatment. Advanced age for the mother, cysts that are reported as complex, meaning they have fluid part and solid part, and they may have thick wall, right, with multiple protrusions from the wall into the cyst content, right? That may be a concern. And when I refer to what I've basically just described about the nature of those cysts, we might get concerned about possible ovarian growth that could turn out to be cancerous. And so it's important, therefore, that when a cyst is increasingly growing in size, when a cyst, we pick it up and we notice it is complex, it has both solid and liquid part with thickened wall, that is important that we evaluate. And there are some tests that we do that help us to delineate whether there is a likelihood of that cystic collection being cancerous or not. Of course, the truth meter comes with removing the cyst or the whole ovary and taking it to the laboratory to be assessed and determine whether was it really indeed a cancerous cyst. The question that probably we needed to also explore further is, with the new technology of Hifu, can Hifu be used to treat cyst? And the answer is a firm no. Hifu is not an option to treat cystic lesions or cystic growths. The reason is the ultrasound, the high intensity ultrasound that we are using is best suited for solid growths or solid tumors. And as we said, a cyst is a collection of fluid that is bound by a capsule, bound by a membrane. Okay? And so the content of the cyst is fluid. Even if it is complex, they are fluidy part. And in those places, the ultrasound is likely to pass through and therefore cause injury to the beyond organs, which is not the intended purpose. So it cannot therefore be used to treat a cyst. Finally, if you have a cyst, and so someone tells you have a cyst, or from an ultrasound you are told that you probably have an ovarian cyst, don't ignore it. Please don't ignore it. Seek the right health care. And this right health care will entail an ultrasound being done after the doctor has taken adequate history and examined you. Then based on the ultrasound findings and your issues that you presented with an examination, the doctor may suggest either you take care of the pain and then follow you up, or just do the watchful monitoring with a repeat scan in 3 to 6 months. Or the doctor may advise you to do further evaluations, including laboratory tests, certain chemicals that will be able to help us make a better decision. Having done that, then the treatment would either be observing, do nothing, taking care of the symptoms, including pain, or doing surgery, and the surgery would then depend on the size of the cyst, what is thought that it could be based on what has been done, and that will include probably an extensive surgery and further treatment depending on the lab report of what we shall have removed. I hope that was helpful. Take home, don't ignore it. But not all requires to be treated or to be operated. And finally, no, Hifu does not or is not an option for treating cystic lesions or cystic growths. Thank you.